I found my article on the KVCC library, and it is a peer-reviewed article. The name is Providers' Perspectives on Case Management of a Healthy Start Program, a qualitative study. The article states that high rates of preterm births, infant and maternal mortality in the United States, as well as continuing disparities of pregnancy outcomes, have actually caused a lot of federal and state agencies to develop programs that would intervene so that there could be more of a quality of continued care for women of childbearing age. A lot of this is done through case management and home visiting programs that help to improve the health of women and their families from postnatal period through the subsequent pregnancies, to pregnancy screening for risk of complications of pregnancy, the extended use of preconception health to decrease those risks, and finally the expansion of private and public health care coverage to low-income women. Healthy Start is the program that we're going to be looking at today. It's federally funded and it runs back to 1991, and it's for an integrated system of care for high-risk expectant mothers, infants, and their families. Consumers of the Healthy Start services have found that they have had increased access to coordinated care and positive health outcomes for their families. But now we'd like to take a look at the case manager's perspective. Case managers from 4 program services got together to conduct a survey in 2 different focus groups. They got together to talk about the challenges that they felt they faced in bringing these services to the community. Case managers felt that one of the biggest challenges was to have organization in the work environment. They felt that to meet the complex needs of their clients, they needed to have more decision making available for them. And a lot of this they found to be helpful with knowing that they could go to their coworkers as a resource or to have open conversations with supervisors about ideas. Case managers stated that some things are inconsistent, which makes it hard. Workers can sometimes be inconsistent because people who hold a PhD don't necessarily want to get paid a lower scale and end up having work that is very dangerous, because a lot of work done in these particular areas are city populations like in Chicago. And a part of that is, yes, a lot of these workers have a PhD, but a lot of these case managers felt that a lot of their growing truly happened in the field, and they felt that there should be more training. Basically, their peer training was what was most helpful to them, and they really felt that there should be more in that area that prepared them to be working in these inner cities. A lot of the clients that they serve are of low income, and the neighborhoods are becoming too expensive for them to live. So there's a lot of people moving in and out, and if they move out of a targeted area for services, they can no longer serve the client. So there's a high turnover rate in that area as well. Case managers state that the pressure to perform these home visitations and to meet contractual requirements is just extremely difficult. They say that, for example, out of the 80 face-to-face that they would have to meet with for clients, 40 of them have to be home visits and 40 office visits, assuming that all the clients come in to see us. But they said it's not possible unless there are boundaries where they can go to see these clients. The case managers in this study felt that there was a lack of client incentives that were to assist them in outreach and client retention, and they felt that these incentives should be made more available to their clients in order for them to want to get out and go to these different appointments and to get in the community and be integrated in services. Some of the things noted by the case managers as well were that clients were struggling in finding childcare to even get to different meetings that they wanted to be a part of. Sometimes it was just time of day and getting up with the kids if they were allowed to go. Sometimes, it's just a lack of having transportation and they're not being transferred bus carts. So the findings of this study is that there has been inconsistent implementation in the case management services, and basically they wanted to call for a new model where they can meet people where they're at and find a way to expand the areas that they can serve, and basically just pull the community together to meet the needs of these clients. It is great that when this study was done, case managers were pulled aside from their supervisors and talked to separately. It was conducted with open-ended questions. Everything was recorded, so all of the facts that were later stated were definitely exactly what these case managers said, because it was quoted directly from the recording. There are some limitations to the study that was done because there was only 19 respondents, and that does appear small, but it really did cover a lot of Chicago, and it was 4 different service centers of this program that participated. Another thing is a lot of participants were new to the program, 1 to 2 years. Like I said, there was a high turnover rate, and the ethnic groups were not diverse. However, I think if we look at the case management role, a lot of these situations that they brought up and concerns are legit, because we need to provide effective care integration for clients, but it's difficult when there's turnover rates or different barriers that keep moms or dads from getting involved in the services they need. I would have to agree, though, that not all the issues fall right on the case manager's shoulders. There needs to be new approaches that help these case managers to actually implement what they're supposed to be doing, a way that brings together all the services and considers the client's needs to actually obtain these services. Thank you for listening. Here is the citation for the article I used.